My name is Allyson Mackay, and I am working on the Health eLearning project. My partners are Avar Vikar and Shannon Fearday. So our project largely is to implement a learning management system for 2 different hospitals in Chennai, India. And I think one of our first questions was, why a learning management system? What do you need this for? What is the reason that we need to implement a learning management system for you now? And we dug in and we talked to them. We found out there's a shortage of skilled nurses and physicians. A lot of times what's happening is the really experienced, skilled nurses are going to leave the country. They're going to go work somewhere else where they can get better pay, better salary. And so they just don't have, there's a gap, an experience gap and a skill gap. And so they need some way to skill up their employees in order to provide a standard of care across the hospital. And that standard of care is going to provide better patient safety and quality for the patients. And also, I think along the way, they want to build this idea of continuous education in the hospital. That doesn't exist. It's like, why would I do a training unless I get a certificate? I'm only going to do it for that. So to sort of enhance what is learning and what is education at the hospital. And so we're working with 2 different hospitals, right? So, and they're each different. They're different, and they have these distinct stories. So Be Well is a younger, smaller hospital. It's been around for about 5 years, and they have 7 different locations in the state of Tamil Nadu, right? And some of these are 7 hours apart from each other. So you've got a distributed hospital system, and they have no formal training education program going on. The other hospital is SMF. They've been around for more than 20 years, and they take doctors who've recently received a degree, and they do sort of like the residency training program. But they're strapped for physical space. They have some challenges in booking rooms, and even just, getting everyone in the same place at the same time to do this in the clinical workflow. So they're hoping to use the LMS to keep them at the forefront of health training and sort of ease the flow there. So how does that all come together? How can we accommodate 2 different health systems with 2 distinct stories? Well, if you think about it, ultimately they have the same shared goals, which include doing this sort of data-driven learning assessment of the training and of the learners. They want to provide access to educational resources around health and healthcare that weren't available before, and they want to do that in line with what are the hospital goals and around providing quality care. And lastly, they want to integrate active learning into this culture. So, and to do that, we have created Health eLearning, which is based on the open source learning management system Moodle. And we have been implementing this according to a 6-phase sort of model. And we intend to start our training when we get to India. So we're going to do a train-the-trainer approach, and we'll be training a core group of users who will then go on to train, and we will hopefully be there for the training of that second group. So we're really excited. We've done our user testing already, and we've gotten really good feedback. So we're ready to hit the ground running.